Hey gang, I'm falling behind here a little bit on these videos. I guess that's just kind of the nature of the deal here. There's been a lot of um, just a lot of unexpected things that have happened since the surgery, and it's not been as easy to get in front of this camera as I thought it was going to be. So let me talk about the day of the surgery real quick. So we got up early in the morning, excuse me, had to be up at the center by like 7 o'clock. They checked us in. They do a lot of prep work, right? You get an IV drip in one arm. They trim the hair off the knee area, and excuse me, um, you know, very friendly, very polite. The nurses and the techs, everybody was great. They get you set up in like a little room, and they kind of get you cued, right? The doctor comes in. He checks with you about what the procedure is going to be. You verify everything in writing. They drew on the knee to make sure they had the correct knee. The anesthesiologist visited. I talked to him about a couple of things. He offered me two options. One was to go to sleep. One was to do a spinal. We had kind of talked about this already at the doctor's office, and I had decided that going to sleep would be the way to go. And then they came in to do a nerve block. When they did the nerve block, they put something in the IV, and it basically instantly knocked me out. And I mean, I was out. I kept coming to, and it was very emotional. I remember having a lot of emotion when I would wake up. But they switched the medications or something. It's all a little bit foggy. And then I remember getting a hug from my wife and being wheeled into surgery. And then I remember waking up. And really that was it, guys. I'm not going to lie, it was terrifying for me. I really didn't want to be put to sleep, but they recommended that that was the best way to go. But I thought I should just share in general terms very quickly what the sequence of events was, and then, waking up, right? And when you wake up, everything then becomes real again. So I woke up, the leg was totally numb, it was braced. They gave me a pile of instructions. Thank God my wife was there to jot things down. They give us a lot of things in writing, and then they checked us out. And honestly, there was very little pain at all. But the leg was numb from the upper middle thigh all the way down to the tip of my big toe. The bottom of my foot I had sensation. The top of my foot I didn't. Everything else is very numb. You could not lift your foot towards the top, towards your shin. Like, I felt like maybe like Jalen Smith, like I had drop foot. But the nerves were all shut off. And that was nice. And I'm saying it was nice because when I get into my next video and explain what happened when it wore off, I think you'll understand why I'm saying it was nice. It was a little scary because you don't know if it's going to wake up and you're touching yourself and you can't, like your finger tells you you're touching your skin, but your skin doesn't tell you that it's being touched. And not being able to move or lift your foot is really weird. Like you concentrate and concentrate and concentrate, and you know you're telling it to lift, but it just won't lift. So anyway, I'm going to cut this one off real short and sweet. That's the experience of surgery day, and I'm going to get into the next day on the next video. Okay?